Right. Good morning, everyone. We are right at the top of the hour, so we will go ahead and get started. I want to first start out by welcoming everyone and thanking you for taking the time out of your day to join us here today for this new well-being webinar series that we are kicking off in 2025 for our Univera Healthcare members. My name is Katie Keller-Burgess, and I am the team leader of our well-being team here with Univera Healthcare. I will be the host for today's webinar, teeing up our guest speaker, Dr. Michelle Penque, who will be presenting our January well-being topic of New Year, Well You. So a few housekeeping items that I do start us off with here today. First off, please note that the webinar is being recorded. And that way you should receive an email with the recording, but we'll also keep it housed on our Univera YouTube page. So if you want to go back later and re-listen to some of it, or if you missed something, you can feel free to do so. I do also want to call out that mics and videos are automatically disabled, and that we will be saving time for any questions that any of you may have at the end of Dr. Penque's presentation. But if you do have any questions throughout today's webinar, please feel free to enter them into the Q&A feature at the top of the Teams webinar at any point throughout today's webinar. And once again, we will use time at the end of today's webinar to go through any of the questions that have come through within that Q&A. And lastly, and most importantly, please note that this webinar, along with all of our well-being webinars that we are hosting in 2025, are really intended for educational purposes only. Please note that any benefit-specific questions or concerns should be addressed to the customer care number on the back of your health insurance member ID card. All right, so as mentioned, I am teeing up our guest speaker here today, Dr. Michelle Penque. So she is one of our medical directors with a focus on utilization management at the health plan. She has obtained her medical degree at Jacobs School of Medicine in Buffalo, where she completed her residency and continues as a clinical associate professor of pediatrics. Prior to joining the health plan in 2024, she spent 25 years caring for pediatric patients, and she served as the medical director working with hospital leadership to enhance processes as well as patient care. So Dr. Penque continues to care for patients and provide clinical instruction to medical students, residents, and fellow at the Oshai Children's Hospital. And she loves spending time with her family, friends, traveling, hiking, puzzles, a good book, and of course, football. Would not be remiss to not say go Bills after the game this weekend. So once again, Dr. Penque, want to thank you for joining us here today, being the guest speaker for the New Year Well You webinar, and I will turn it over to you to walk us through today's presentation.
Thank you so much for that introduction, and I have to say go Bills, even though it said it on there. So, so today, our agenda to start off with, we'll be talking about the benefits of a New Year's resolution, some healthy habits to implement for the new year, how to build and stick to your habits, the importance of preventative health, and your role in preventative health, as well as the role of a primary care physician in your life, and preventative screenings and some related benefits. I'll hand it off for them to talk about that. To start off with, let's talk about New Year's resolutions and the benefits of that. So the New Year is a great time to reflect and set intentions for the new year with our resolutions. It often provides a feeling of a fresh share and symbolizes a chance to reset. There are several benefits to selecting goals for the new year. It provides a fresh start, creates the opportunity to redefine your personal, professional goals, and creates a motivational boost, and holds you accountable and aids in overall personal growth and well-being. Today, we're going to be jumping into healthy habits for the new year, which you can use to help guide your resolutions, preventative health to keep and help you stay healthy, and ways we are here to support you and support your health in your journey this year. So we're going to focus on 4 healthy habits, and they are right here. So we have physical activity, stress management, nutrition, and limiting substance use. And you can personalize these goals so that they work for you. What works for someone else may not work for you. So you're going to create your own unique way to incorporate these healthy habits into your new year. If you're participating in something you enjoy, we all know that you're much more likely to stick with them. So the first one we'll start off with is physical activity, which is one of the best things that you can do for your health. It helps you build healthy bones and muscles, helps aid in healthy weight, helps to reduce anxiety and depression, and helps manage your stress, helps you feel energized, and improves your overall health and well-being. I was surprised by this number, but an estimated 110 deaths per year could be prevented in the US for adults age 40 and older if they just increase their moderate to vigorous physical activity. And seriously, even 10 minutes or more a day can help make a difference. So according to the CDC, adults need at least 150 minutes of moderate intensity physical activity a week, which would be like 30 minutes a day, 5 days a week. You can do it in 10-minute increments 3 times a day, whatever works best for you, as long as you just get up and move and do some stuff. If you're 65 and older, you need aerobic muscle strengthening and balance activities each week. It's really important as you get older to have that balance so you don't fall. Getting started. Any change you have to move, any chance you have to move, you should do it. Some movement's better than none at all. So move your body in a way that you enjoy, like park at the furthest end of the parking lot, or get up and walk during your meetings at work, or even some people even have the little under desk walking pads, which I invested in since it's so cold this time of year in where we are in Buffalo with our -10 wind chill factor. So it works for me. Next, we'll talk about nutrition. So good nutrition is essential across life stages, from infant and child growth and brain development to healthy, safer pregnancies and healthy aging. There are several other benefits to eating a healthy diet, and that includes a reduced risk of chronic diseases, increased energy levels, healthy digestion, improved cognitive function, and a strengthened immune system. Fun nutrition fact: fewer than 1 in 10 children and adults eat the recommended amount of vegetables. Most people in the US need to increase their daily intake of dietary fiber, calcium, potassium, and especially up here in the north, vitamin D. Getting started. Should focus on whole foods, eat mindfully and healthy foods to help try to eat healthy foods for your diet instead of just restricting the foods that you're not supposed to eat. So eat stuff that you enjoy, plan out healthy meals, read the labels, and try to stay hydrated, which is one of my New Year's resolutions, is to drink more water. So I've got my little Univera glass here to keep that up. And you can find more tips on the CDC's Healthy Eating Tips page. The third that we'll talk about is stress management. So long-term stress can lead to worsening health problems. Managing your stress daily can prevent you from developing long-term stress. So learning to cope in a healthy way can help you reduce this stress. There are several benefits to implementing stress management techniques, like improved sleep, enhanced focus on productivity, improved resilience, building stronger relationships. It improves your physical health and your overall health and well-being. Some good techniques to get started: you can incorporate mindfulness and meditation, prioritizing activities you enjoy, regular exercise, which goes back to our first topic, establishing a routine, and identifying your stress triggers. And our final of the 4, we'll talk about excessive alcohol and substance use, which can have immediate and long-term health risks. Excessive alcohol and substance use can lead to high blood pressure, heart disease, liver disease, strokes, substance abuse disorders, digestive problems, and a weaker immune system. There are several benefits to limiting substances like drugs and alcohol, such as improved physical and mental health, enhanced mental clarity, better relationships, increased energy levels, greater self-esteem, and more. To get started, limit caffeine and alcohol consumption, take medications only as directed, build a support network to be there for you when you need it, identify your triggers, and seek professional help if needed. How to build and stick to a habit. So habits take time to develop. And depending on who you ask and where you look for information, you may get answers anywhere from 3 days to 3 weeks to 66 days and sometimes even longer. So habits are not a one-size-fits-all process, but by applying these strategies, you can help build and maintain habits over time. Like starting small. So begin with something that's manageable. Don't try to say, I'm going to run a marathon in a week or anything. Just 10-minute chunks of exercise. I'm going to eat something better each day, something like that, and make it a clear goal. So today is 10 minutes, next week, 15 minutes of exercise, something like that, that it's a very clear goal that you have a set number so that you can follow it. And, print out a flow chart and track your progress. That helps too, so you can see how you're doing and helps you reward yourself by seeing how much progress that you've made, and stay positive and reward yourself. So now we'll talk about the importance of preventative care. Preventative care is essential in maintaining your overall health and well-being. And today we will dive into the importance of preventative health and your role in preventative health. So there are 3 reasons why preventative screenings are so important. And we'll talk about those now. So no matter your age, checking in on your health is important. A great first step is choosing a primary care physician. So number 1, early detection saves lives. Finding out about a problem early can mean that treatment is more effective. Routine health exams, like a yearly physical, for example, gives your doctor a chance to find potential risk factors, such as high blood pressure or a concerning mole. Then they can provide a solution before the risk factor becomes more serious. Number 2, staying healthy inside and out. Preventative screenings cover concerns that you can see as well as those that you can't. Your doctor can check for high blood pressure, diabetes, elevated cholesterol, mental health needs, and weight concerns. And number 3, taking control of your health. The more you know about your body, the better you or your doctor can help take care of it. And if you're nervous about what the results might be, well, that's perfectly normal, but that's also why screenings are so important. If there is something to be concerned about, your doctor is there to answer questions and guide you through your next steps. Just like your car needs oil changes in order to keep running smoothly, your health requires routine maintenance. Preventative healthcare screenings are simple checkups that doctors provide to keep your body working at its best. And since most of them only happen once per year, you need them less often than you need an oil change. And here we'll cover some of the preventative care recommendations. And essentially, we start off with your annual visit. Just once a year, you go in to check out how it's going. They'll talk about diet, your sleep, medications, your mood, and any screenings that you may be due for. For women here in the middle, there's the mammogram and pap smears. So mammograms starting around age 40, unless you're at high risk, then it can be 35 if you have a family history. And then you get them every 1 to 2 years after that. And it's very important because if you detect breast cancer early, it is so much easier to treat than if it's caught later on. Same with cervical cancer, starting at age 21, and you get them every 3 to 5 years until 65. So pretty soon I'll be able to be done with my pap smears, yay. It helps to prevent things like cervical cancer. And then colon cancer. So that has been increasing in prevalence at a younger age lately. So it's very, very important to get your colon cancer screening. They've lowered the age to 45. It used to be 50. And so they want you to get that colonoscopy and then every 5 to 10 years based on your risk factors. And it may even be younger than 45 based on your family history. So make sure you get these screenings done because they're very, very, very important. And it could save your life. And then we'll talk about taking an active role in your health. So in the past, the doctor was perceived as the driver of your healthcare, and patients didn't really ask too many questions. But there has been a big shift in that recently, and the shift is from being a passive participant and recipient of healthcare to an active participant. Patients are expected to actively participate in making decisions, to learn as much as possible about their health, and to be responsible for helping to manage their conditions. This means working in partnership with your providers and care team for developing treatment plans that address what is most important to you. Furthermore, it can help improve satisfaction and improve health outcomes. So here are 5 ways that you can take an active role in your health. Number 1 is to ask questions of your medical care team, your nurses, pharmacists. Number 2 is to be prepared for medical appointments. You should have an updated list of your medications, allergies, and your emergency contacts. Number 3 is to keep track of your health information and track any symptoms or changes in your health that you've noticed, no matter how small or insignificant it may seem to you. It never hurts to mention it. Number 4, know your family health history, and understanding your risk of certain diseases based on your family history can help your doctor better plan for screenings and treatments. And number 5, taking notes during your doctor's visit. Doctors usually cover a lot, so writing down important points help you reference it later on. And I can tell you from a personal standpoint, when sometimes you just don't hear some of the things that are being said because there's so much happening. So make sure you take some notes. It's important. Remember, you are in the driver's seat of your healthcare. And next, I will hand it off so that they can talk about some of these related benefits to help you.
You're on mute, Katie.
Thank you so much, Dr. Penke and Kate, for calling that out. I appreciate it. Appreciate the patience while I regained control, got us to the slides. But as Dr. Penke mentioned, we are next going to review some related benefits that may be available to you as a Univera Healthcare member. Please note that the availability of the benefits and programs that we are going to review does vary by contract. So we do encourage you to either log into your Univera Healthcare online account, or once again, call that customer care number on the back of your health insurance card to confirm benefit eligibility of any of the programs that we discuss here. So the first thing we're going to talk about is our Find a Doctor tool that is available to our Univera Healthcare members. So our members are able to find doctors, compare cost, and connect with confidence. They are able to find a doctor or provider that fits all of their needs. So they can search for doctors, specialists, urgent cares, hospitals, and more in our local and national networks. Filters, members are able to filter by specialists, languages spoken, if the provider is accepting new patients, and more. Our members are able to see a side-by-side comparison of providers and even create a PDF of the results to save, share, or print if needed. You are also able to access our cost estimator tool, which is going to help our members budget for any potential medical expenses. So our members are able to log in for estimated out-of-pocket medical cost based on your year-to-year spending and potential deductible. And you're able to research estimated medical costs across more than 1,600 different treatment categories, as well as 400 procedures. So yes, that Find a Doctor and Cost Estimator tool, great tool to log into through Univera online account and access those to be able to find care as well as potential procedures if needed. All right, so the next benefit that I do want to discuss is our member care management team, as well as one way to connect through them with the free WellFrame app. So our member care management team that is available through Univera Healthcare is here for you whenever you need us. Our team of professional healthcare providers include registered nurses, registered dietitians, behavioral health specialists, and more that are all here to help. So whether it be from little questions to big health challenges, once again, our care managers can help support our members of all ages at no added cost. So you can engage with our care management team through either phone call, email, or as mentioned, one of the best and easiest ways that I think to connect with that care management team is by downloading the free WellFrame app on your smart device. So the WellFrame app is a convenient way to get that instant access to one of our care managers by utilizing a confidential text-to-chat feature right through the app. So that is going to help provide you as a member one-on-one personal support and guidance wherever you may be on your well-being journey. So you can see some of the common concerns that our care management team can help address with members include substance use, anxiety or depression, diabetes, high blood pressure, maternal health, asthma, stress management, weight loss, smoking cessation. So many of the items that Dr. Penke mentioned in, the great things to consider when starting off a new year and helping to better support your well-being, all once again can be additionally supported through our care management team and the WellFrame app. So once again, it is a free app our members are able to download, create your account, and log in to engage with that care management team for that support. And I do want to call out that the access code to use when downloading and creating your WellFrame account is Univera Welcome, all one word, all lowercase. So once again, that access code is Univera Welcome, all lowercase, one word when setting up your account if you download that WellFrame app and decide to engage with the care management team through that method. All right. So up next, we are excited to talk about another well-being program that may be available based on your contract, which is Vitalize. So Vitalize is a digital home base for your health and well-being. Vitalize is powered through our partnership with Personify Health. And this program will give you the tools and support you need to make small everyday changes to your well-being that are really focused in on the areas that you want to improve the most. So maybe it is trying to be more physically active. Maybe it is trying to eat healthier. Or maybe it is trying to better manage those stress levels, as we all are. Whatever it is, once again, right through that Vitalize platform, you're able to engage in a variety of tools and resources to help you get and stay healthy, whether that be building upon healthy habits, having fun with friends, and maybe some competitive challenges for your well-being, and really just experience the lifelong rewards of better health and well-being along the way. You're able to take a health risk assessment, as coined their health check, to provide you a more detailed or personalized experience, if you will, within the platform, once again, based on areas that you are looking to personally improve upon. So a great tool, once again, that may be available to you. We do encourage you to log into your Univera online account, and then once again, check under the Health and Wellness tab to see if you have that access to Vitalize if interested in engaging with this tool. Now, the next program I want to go over is Perks for You. So living a well-balanced lifestyle is all about making good choices on a daily basis. And with the Perks for You program available through Univera Healthcare, it can help you do just that. You're able to stay healthier for less with our Perks for You program that is offering our members exclusive discounts on healthy programs, products, services, and vendors throughout Western New York. So once again, we encourage you to log into your Univera online account and check it out to receive eligible discounts at any of the participating vendor locations just by showing your Univera Healthcare member ID card. All right, we are going to wrap it up here. So Dr. Penke, I'll turn it back to you to wrap us up here.
Okay, thank you so much. And here we'll just run over a few of the steps to a healthier you in the new year. So remember, get your recommended health screenings for your age. Try to be active. 10 minutes a day, a couple times a day can make a huge difference in how you feel, in your stress management, in your life. So try to do that. Eating a healthier diet, like fruits, vegetables, some lean meats and whole grains, and try to find some healthy ways to manage your stress. Meditation, exercise, some app for even 5 to 10 minutes of relaxation is a great thing, especially right before bed. It's really good. Or before a talk that you have to give that you're nervous about. Get enough sleep, super important, 7 to 9 hours a night. And I just want to throw in there, if you snore a lot, have pauses of breathing, try to get checked for sleep apnea because it's really important to get that treated to get yourself some good sleep. Can help prevent cognitive dementia later on in life, and nobody wants that. So practicing some self-care, whatever that looks like for you, limiting caffeine and alcohol. I got to work on the caffeine thing a little bit, but I'm trying, but I'm increasing my water intake and substituting out some of my coffee. So I'm trying myself too. I hit some New Year's resolutions myself. And taking prescriptions as prescribed by your doctor, meaning like take them if they say to take them for 10 days, even though you feel better at day 5, complete that also and adhere to what the bottle says. So that is that.
Wonderful.
And I think the questions. So thank you all for attending. And I think is the question and answer session now.
Yep. Thank you so much, Dr. Penke. A lot of great information that was gone over throughout. So going over into the Q&A, there has been no questions that have come through as of yet. So if anyone does have any questions, feel free to enter them. We'll give a few seconds here. But once again, we do appreciate everyone taking time out of their day to join us here today for the New Year Well You webinar hosted by Dr. Penke. Hopefully great information that you're able to take and implement into your daily routine. So once again, no questions at this time. So Dr. Penke, I do just want to thank you for once again going over all of the great information here today. We do appreciate it. We'll go ahead here and wrap up since no questions. But once again, thank you all, and I hope you have a wonderful day.